The COVID-19 pandemic was hard for everyone, especially for families with children. The effects of the pandemic on families are still being measured, but 3 surveys conducted between November 2020 and July 2021 provide a snapshot of the effects of the pandemic on caregivers. Results can inform ways pediatricians and home visitors help families navigate stressors from the pandemic. Let's start with the financial impact. In the surveys of 9,000 caregivers with children younger than 18, about 50% reported a change in employment status. Many caregivers cut back on working hours to provide care, and that was twice as likely for women as it was for men. The result? Financially stressed households. This was partially addressed by government assistance. Some families received unemployment, stimulus checks, food support, and protection from eviction. Nevertheless, children's lives were changed. Most U.S. children experienced disruptions in their lives during the pandemic, and this had effects on family closeness. 60% of families reported growing closer, even though disruptions in education also led to increased tension in many households. Intimate partner violence, both physical and psychological, continued to impact families, especially during the pandemic. More than 20% of adults reported experiencing intimate partner violence, or IPV. It's important to note, both men and women reported IPV. For children, witnessing IPV is an adverse childhood experience, or ACE, and it can increase their risk for lifelong problems with mental, physical, and behavioral health. Survey results show families experiencing economic or psychological distress reported higher rates of IPV. Caregivers reported using many different strategies to discipline their children. About 83% of parents said they did not spank their children in the week before the survey, but about 50% reported yelling at or threatening them. Many parents, including those who spanked their children, used positive parenting strategies. Families with children and youth with special health care needs experienced persistent challenges during the pandemic. Caregivers who provided services for their children with special health care needs were more likely to report feeling overwhelmed. There were high rates of disruption in daycare, health care, and employment, as well as the loss of technological and therapeutic supports. Parents of children and youth with special health care needs also reported more IPV and spanking of children. But despite these challenges, most of these parents reported feeling quite close or extremely close to their children. They cooked together, played together, and used positive discipline strategies. Lastly, families with young children reported concerns about their kids' education. More than 50% of parents surveyed worried their youngest school-age child had fallen behind in school. This was especially true for children in hybrid or fully remote schools. And in households with certain problems, like financial challenges, no daily routines for the children, and IPV, parents worried their children were falling behind at higher rates. These concerns were associated with parents spanking and feeling angry at their children. Pediatricians and pediatric healthcare providers are uniquely positioned to support children and families. They can model safe, stable, and nurturing relationships and talk about the importance of household routines and positive discipline strategies. Healthcare providers can ask families about their specific concerns and offer support, including making key connections to needed resources like food, shelter, and domestic violence agencies. Working together, we can help families navigate stressors, build resilience, and create more opportunities to thrive. Visit www.aap.org/family snapshots for more information.